listening to Evergreen Media Network. I am Cindy Schwartz. This is the Patient Partner Show, and we are also a podcast on Spreaker. Jeannie Roller is my co-host. She is in Indiana. I am in South Florida, and we're talking about medical trauma today, Jeannie. You know, it happened to both of us. I think I didn't really know that that's what it was, honestly, when they labeled it medical PTSD. That catchphrase, which it seems that's what it is. A lot of people say, oh, yeah, everybody's got the PTSD nowadays. It's kind of like when everyone started getting diagnosed with ADHD and things like that. And I was sort of in that school because I didn't really realize that people growing up in dysfunctional families have trauma all along and have PTSD all along in a lot of the instances. And now they've come out with another phrase for it is complex PTSD, which delves into more of it. And it does make a lot of sense. And if you do go to therapy and therapists and you ask them about different things like that, they will talk with you about that. And yes, it is valid. It is viable. A diagnosis is viable, those kind of things. But the medical aspect of it it's astounding because your mind in all of the PTSD, this is all my opinion, I'm not a doctor, your mind doesn't know how to process any of this stuff. And all you want to do, in my instance, is feel safe. That's what I wanted when it happened to me. And my mind would do anything to try to convince myself that I was going to be safe again, because when the medical harm happened to me, that's what happened. That's what snapped. I was like, I'm not even safe in an environment that I should be absolutely safe in. And so that's what the PTSD for me was. But you're right, Jeannie, bringing this up, because there are different ways to take care of it. There's different explanations for medical trauma now, and it's just quite the subject. It happens more often than we admit or know or have data about, because a lot of the instances aren't recorded. I know people told me, yeah, that didn't really happen to you, when I know that it did, the same as yours. We've said that over and over and over again, which just added fuel to the fire in my mind, because I'm like, now I have to defend myself that it actually did happen. And to explain that it did happen, I have it rolling around in my brain again, and I can't file it away because my brain doesn't know where to file it because it's just so horrendous. So go ahead and talk about what you found out with the research and stuff that you've done, Jeannie.
Okay, well, I was looking through this article, PC or PCOM.edu. It was written in June of 2023 from a man who was pursuing his Master's of Science. And he was doing research on traumatic experiences in medical settings. And he wanted to prepare healthcare professionals to prevent and or respond to medical trauma. So they have defined what medical trauma is. It is the experience of a traumatic stress as a result of interactions with the medical system, which may include procedures like surgeries, new diagnoses like cancer, or even just the professionals in the healthcare setting. You can get it from anywhere, like a hospital, even a doctor's office. There is no common example of a trauma because each person can experience it differently.
Yeah.
It can be like a perceived threat of life as a result of an event or interaction within the medical setting. Now, what I found fascinating were some of the symptoms of medical trauma.
Okay.
And they can vary greatly from person to person, but they may include intrusive thoughts or memories of the traumatic event, avoidance of medical procedures or settings, anxiety, depression, anger, and feelings of helplessness or hopelessness. They also can include physical symptoms such as headaches, insomnia, fatigue. So for each individual, it may be different. So I think, Cindy, you and both my husband have suffered some of these symptoms of medical trauma, which we actually call medical PTSD, which I think is kind of an interchangeable term as between the two. And there's different approaches on how to treat it. the most common approach is to seek therapy from a mental health professional, which
Right.
for my husband, he said no because he didn't trust anyone involved in the medical world any longer. So for him, we had to find alternative methods,
Mm-hmm.
which once we recognized what he was suffering from, and really me, then that gave us the ability to do research on what to do. I think that, a lot of people do try counseling, which for some may or may not work. I know some who've tried counseling, and they've even tried drug therapies, which may or may not be successful, which may or may not actually give them other symptoms to have to deal with.
Right. Yeah. Side effects. Yeah.
Yeah. So there's just better ways. But the thing I think is important in what I read in this article is for healthcare providers to recognize that they may be inflicting medical trauma on a patient. They need to know, recognize what they're doing, that it could cause trauma to a person, whether they mean to or not, it could cause trauma.
Yeah.
So I think that's very important for medical professionals to be trained in that, from even the lady at the front desk all the way up to the doctor, the surgeon. I think everyone needs to be trained to know that medical trauma is an outcome, can be an outcome of medical treatment.
Yeah, I totally agree with you. And it also shows, too, that 2 people, 3 people, however many people you want to put in a room, everyone's going to have a different experience given the same catalyst, if you will. So we know that across the board, basically, in life, if you will. Not everyone's going to have the same reactions. But the thing that I hear, in listening through what you're saying is that we've talked so many times about how the training for medical professionals now has been accelerated, if you will. So here's more stuff that you have to add on to train these people, but yet everyone's short-staffed. So we've talked about how male patients for intimate procedures, male nurses, techs, are few and far between. Male doctors in certain areas, certainly rural areas, and also in areas of medicine are limited. We're dealing with all of that. So it's just this giant conundrum, but it is a reality that medical trauma does exist. People aren't used to it. It's not a normal function, if you will, for lack of a better word, in people's lives to be immersed in the medical setting. I don't think any of us can say, unless you're in that profession, that we're scared of it. You're anxious. You don't know what's going to happen. You don't know what the diagnosis is. So many people, even still to this day, with the millions and billions of dollars that have been spent on cancer research, are petrified of that cancer diagnosis. I mean, I'm here to say the earlier that you get things like that, the better off you are, even though you don't want to hear it, but you're setting yourself for hopefully a better outcome with different treatments that you can get. So, learn it early is my motto with any of that. Don't be afraid of all of that. But I get it. I mean, I was a victim of the medical PTSD. I still have days with triggers. I go to different doctors, different facilities. Actually, some of them I can't go to. And what I found for me is what's worked for a lot of people in other avenues, not necessarily medical trauma, but just trauma and PTSD in general, is animal therapy. So that's what worked with me. When I got my dog, it just brought my mind back to it. It had been quite a few years since I had a dog, and I adopted one, and it just brought me back to a time like 15 years before that when everything was safe and this hadn't happened, and my mind then could process, well, I'm going to be safe again because this whole scenario seems safer to me. So that's what helped me. Right. And as well as I went to counseling religiously, I did for intense counseling. So everybody's got to work on it themselves. I mean, that's a mute point, really. We all know that. But the thing about it is to get yourself help and to realize that this really does happen. Medical trauma does happen. On that note, stay listening to Evergreen Media Network.